My name is Clayton Parks. I am visiting assistant professor here at the College of Dentistry in the Department of Orthodontics. I practice in Cedar Rapids full-time at Parks & Schmidt Orthodontics, and I've been in practice for about 20 years. I graduated at Iowa in 1998 and then went on and did my orthodontic training and finished here in 2000. When I was in college, I was considering going into vet school. I'd grown up with horses and dogs and always kind of saw myself doing that. When I was in college, I ran into a close friend who had just been accepted into dental school, and I kind of gave it another thought and applied and was accepted. In my position here, I'm mostly clinical orthodontics. I oversee Journal Club, which helps keep residents current on journal articles. I oversee a course, we call it the ABO course, so it's a board certification prep course. Going through cases and doing lectures with the residents. I do a lecture on clear aligner therapy as well. From a teaching perspective, young minds are just absorbing everything, and so dental students are no different. Some, they love general dentistry. Others, kind of find themselves attracted to an area of dentistry where they really want to know everything about it. In my case, that's how I was and ended up in ortho, but I felt like every time I went through a different specialty in my training that, I just really wanted to get involved in that and know as much as I could about it. When you're teaching, especially, let's say the residents in this case, and it's just really amazing within the first 6 months, you just kind of see the lights click on. And so, everything starts to come together. And we watch that get refined over the next year and a half, and even more so once they're out in private practice and we talk later on down the road. It's pretty evident when you look at befores and afters in doing orthodontics from the patient experience, seeing them come in, oftentimes not wanting to smile, oftentimes covering their mouth, oftentimes ashamed at various ages, sometimes adults, sometimes they're young kids, sometimes they're at that age where they're being bullied at school. When we end up with a final product and a child can smile and it looks amazing, I think that's pretty rewarding right there. The University of Iowa, I would say both in the dental college and in our orthodontic residency program, I think would probably rank in the top 5 nationally at any time over the last 40 years. The college here has a long history, an excellent reputation. In our orthodontic department, I would say we have probably one of the greatest faculties of anywhere. Everybody gets along really well, we work together, we're each other's cheerleaders, and I think that then reflects on the students and the education that they get. I'd say, as an orthodontist here, I'm a perfectionist. I'm detailed. I focus on the whole patient. I focus on my diagnosis and my treatment plan. And I think my communication skills with patients are excellent. And I like to pass that on to the students that I'm working with. I found that coming down to the university and working, it's just it's a different pace. It's a different type of reward. It's a whole different experience. I have the time here to work on temporary anchorage devices, new technologies, scanners, cone beams. So things that we typically in our day-to-day practice wouldn't take the time to spend a lot of focus on, we're able to do here at the university. Also, I think we spend a lot more time critiquing our cases and reviewing starts and finishes and assessing the quality of our treatment. In our orthodontic residency program here, we have really a world-class faculty. Not only a world-class faculty, but a faculty who really work together well. Dr. Marino's an incredible leader of the department. She's following big shoes with Dr. Southard. Dr. Marshall's just amazing, Dr. Callan, and Dr. Shin. So I'm just lucky to be a part of it.